Hi everybody, Dr. Daniel. Today I'm talking about what is medication overuse headache. The International Classification of Headache Disorders, Volume 3, describes medication overuse headache, abbreviated MOH, and the old name rebound headache, as a syndrome related to overtreating headache with painkillers. Chronic migraine is the term used for a patient who has headache over 15 days a month, 8 of which have migraine features. A significant number of these patients have medication overuse headache, which is now 89% of new patients seen in specialty headache clinics and affects 4 million people yearly. What is medication overuse headache? Well, medication overuse headache occurs after painkillers or analgesics are taken frequently for headache. The headache pattern from this overtreatment often results in the occurrence of severe, daily, disabling headaches. These headaches usually have migraine features of being severe, throbbing, and associated with nausea and vomiting, and sensitivity to light and sound. Medication overuse headache occurs mainly with migraine patients and rarely also with tension-type headaches. And there is a common pattern of transformation from rare or episodic migraine, which is less than 15 headaches a month, to chronic migraine. This transformation occurs gradually over weeks to months. Many patients fluctuate in and out of medication overuse headache depending on how bad their headaches are and how much medicine they take to treat it. Medication overuse headache is a concerning, disabling, well-known worldwide problem. It's the number one diagnosis for patients in headache practice and affects 1 to 2% of the general population. The problem with medication overuse headache is that patients typically rotate to different drugs and take many drugs at the same time that causes or worsens a headache. Medication overuse headache comes from overtreating with painkillers or headache medications such as simple over-the-counter drugs like caffeine, Tylenol, or Advil, or more complicated drugs like opioid narcotics, painkillers with barbiturates, or triptans. Related questions. What drugs are usually taken that cause medication overuse headache? The International Classification of Headache Disorder, version 3, describes frequent headache from the following classes of drugs: ergotamine overuse headache, triptan overuse headache, non-opiate analgesic overuse headache, paracetamol, Tylenol, or acetaminophen overuse headache, non-steroidal anti-inflammatory drug NSAID overuse headache, acetylsalicylic acid overuse headache, that's aspirin, other non-opiate analgesic overuse headache, opioid overuse headache, or combination analgesic overuse headache. How much medication does it take to cause medication overuse headache? Well, the International Classification of Headache Disorders lists the amount of drugs taken which may cause medication overuse headache as triptans or ergotamine intake over 10 days a month, like one pill over 10 days a month, of like sumatriptan as a triptan, or non-opiate simple analgesics over 15 days a month, and that includes aspirin, Tylenol, caffeine, or NSAIDs like Advil. Opiates or analgesics combined with barbiturates over 10 days a month. What diagnoses do these patients think they have? Only 56% of patients who have migraine have ever had a diagnosis by a doctor. These patients think they have migraine aliases such as sinus headache, menstrual headache, hungry headache, letdown headache, or nocturnal headache. Patients with these features present to the doctor with chronic migraine later due to medication overuse headache. What is the transformation of headache from episodic to chronic? Patients with chronic migraine due to overtreatment often can state the period of time they've had severe, chronic, near-daily headaches. Patients may say it's been that way 3 months or 6 months or a year or the past 10 years, but others can't answer the question. When they had less than 15 days a month, they had episodic migraine, but when the headaches became more than 15 headaches a month or daily, then chronic migraine has developed. And overtreatment of headache is the basic reason for the transformation. What are the clinical features of medication overuse headache? There are 2 clinical features to the syndrome. The headache part, which we've talked about already, daily or very frequent headaches, which are one-sided, throbbing, like migraine, associated with sensitivity to light and sound, nausea, vomiting, and irritability. But this syndrome also causes serotonin, a calming brain neurochemical, level to drop. So the patient may also develop or worsen pre-existing anxiety, depression, poor concentration, panic attacks, and insomnia, which are also core symptoms of the disorder of medication-overuse headache. Migraine, remember, is comorbid, means they occur together with depression 50% of the time and generalized anxiety and panic disorder 40% of the time. It's important to know about the migraine timing cycle. This cycle are 4 steps in the migraine process, the first of which is the trigeminal inflammation by the brainstem. Then the second step occurs at 20-40 minutes into the headache. So if the headache starts at 8, by 8:20 or 8:40, the ganglion, the nerve, the artery, the brain start to release the neuropeptides, neurokinin A, substance P, and CGRP. Then about 2 hours, or about 10 o'clock in the story I'm telling you here, the release of these chemical causes the third step, which is meningeal artery vasodilatation. The fourth step, at 3 to 4 hours since onset, we're talking about 11 to 12 o'clock, there's inflammation of the thalamus, a deep nucleus in the center of the brain, which is called the pain center of the brain. The fourth step is also called central sensitization because steps 1, 2, and 3 occur in the skull but are outside the brain, so that the trigeminal nerve and the artery, the ganglions and cerebral arteries are not part of the brain, but the thalamus is a deep nucleus inside the brain. Why does this transformation occur? A single episode of migraine may last from 4 to 72 hours. That is, a migraine may last up to 3 days. Patients tell me that their migraine sometimes lasts a week or 5 days, and that's not a single episode of migraine, but most likely chronic migraine or episodic migraine, which comes from overtreating. What's going on here? It's from metabolic features of the brain related to the release of the inflammatory vasodilating neurochemicals, the substance P, neurokinin A, and CGRP. If the patient keeps taking medication through the entire length of their 3-day migraine, it comes about so that after 3 days pass, every time they take a cup of coffee from home, which is 130 milligrams of caffeine, or Tylenol or sumatriptan, or worse, hydrocodone, or Trimadol, or the very worst, headache barbiturial drugs such as Fiorinol, which has betabolin in it, then they get 3 more days of the bothersome neurochemicals, and the headache just keeps going on. When the brain becomes sensitized to these drugs, repeat doses causing neuroinflammatory chemicals to release the brain, which keeps the headache going. It's like putting kerosene on a fire to keep the fire going. As long as you put kerosene on, the fire will burn. I saw a migraine patient once who was 64 when we met, and she'd been overtreated with Advil since her mother told her it was okay to take, and she used 4 to 10 every day since she was 6 years old. I saw another man who was 60 who had been taking up to 10 Excedrin migraine tablets, each which has 65 milligrams of caffeine a day since he was a child. And they both improved by detoxing off the medications they had been taking. And these are benign stories mixed in with countless patients who come in taking hydrocodone or tramadol, both of these which are opiate narcotics. But the worst acute migraine drug is clearly a drug with a barbiturate in it, butalbital, such as Fiorinol. Marilyn Monroe overdosed on a barbiturate drug and died. Barbiturate drugs stay in the body for a long time. They don't dialyze out with an overdose. A fact, plus the headache problem, which has limited their use, although where I practice in Dallas, non-neurologist doctors use it a lot and probably advised to give Fiorinol in medical school. They still do it, and I take them patients off. Barbiturate headache drugs have been banned in every country in the world except Canada and the United States because they're notorious for causing medication overuse headache. And so there's a sad kind of weak, pardon me, it's like a joke, it's headache meetings, and yes, that is the United States, so that is, quote, barbiturate headache drugs, the only reason to go from Mexico to the United States for purchase. Apparently you can buy hydrocodone in Mexico without a prescription, but you can't buy Fiorinol. But you can buy it in America. So what are the drugs that usually cause medication-overuse headache? These drugs are Sudafed, pseudoephedrine, the decongestant and over-the-counter meds, such as Tylenol Sinus or Advil Sinus, or the D, which means decongestant appended to an antihistamine like Allegra. So Allegra D has an antihistamine, and D is Sudafed. Also Tylenol or acetaminophen, ergotamine drugs like Caprigot, Ergomar, Migraine, although those are not used so much nowadays, triptans, and those lists are sumatriptan, rizatriptan, zomatriptan, almatriptan, elatriptan, naratriptan, or frovatriptan. Aspirin can cause headache. Aspirin with caffeine drugs very commonly causes, such as Excedrin, Anacin, Odose, Redline, RTD. NSAIDs can cause it. That's non-steroidal anti-inflammatory drugs, such as Motrin, which is ibuprofen, or Advil, or Naproxen, or Anaprox, which is Aleve, and meloxicam. Of course, as I've already mentioned, narcotics like Vicodin, hydrocodone, Narco, Tramadol, Demerol, Nucynta, OxyContin, and Tylenol with codeine can all cause it. And drugs with barbiturates can do it. Fiorinol, Furosec, Frenulin, S-Jec, generic Bubital. So how does one treat these persons with medication-induced headache? The best treatment is stopping the offending drugs, usually one day, or sometimes by tapering off several weeks. If the patient's been on a high dose of an opiate or barbiturate for a long time, you have to be careful with them. And the patient needs to be on a migraine preventive drug, preferably one of the new CGRP drugs, such as Aimovig. They should do the migraine lifestyle. They should limit acute therapy of analgesics or headache medicine to no more than 2 days a week. And hopefully they'll be on a triptan. In the United States, sometimes we just want to take a pill and have whatever medical problem we have go away, to disappear. But going away won't happen with headache if the patient keeps treating. Please see my webpage at www.drmigraine.com for other articles on, these are the titles, do NSAIDs cause medication-induced headache, caffeine, and migraine? Medication-induced headache may be confused with cluster headache. Caffeine discontinuation improves migraine headache symptoms. Migraine and opiate narcotics. Caffeine is a drug. And medication overuse headache. So this is the end of my talk on what is medication overuse headache. God bless all you persons who have migraine. Please click on subscribe and like down there, please, so we can follow each other. Follow me on podcasts for other talks I have on migraine drugs, and I'll see you on the next talk.